Hello, my name is Edmund Tsui, and I'm an assistant professor of ophthalmology and a uveitis specialist at the UCLA Stein Eye Institute and David Geffen School of Medicine in Los Angeles, California. As a physician scientist, I both care for patients and also perform clinical research. My clinical practice centers around patients with uveitis, which is a group of eye diseases that have inflammation of the eye. Uveitis can be caused by autoimmune or infectious causes, or most commonly due to idiopathic or what we call unknown causes. Uveitis is the fifth leading cause of blindness in the United States and accounts for about 10% of patients with legal blindness. This translates into 30,000 new cases of legal blindness each year. Treatment for uveitis most often involves use of steroid eye drops and frequently steroid pills taken by mouth to reduce inflammation. Sometimes, when the disease is severe, we will require the use of immunosuppressive medications taken by mouth or injection, which may be needed for long term to control eye inflammation. The typical symptoms of uveitis include eye pain, eye redness, and blurred vision. And without adequate treatment, uveitis can lead to vision loss and complications such as swelling of the retina, scarring of the iris and retina, elevated eye pressure, which can lead to glaucoma, and all these can lead to permanent vision loss. My research program is centered on children with juvenile idiopathic arthritis-associated uveitis, or JIA-associated uveitis. The overarching goal of my research is to improve the detection, monitoring, and diagnosis of uveitis. Uveitis in patients with JIA is important to address because JIA is the most commonly identifiable cause of uveitis in these children, and up to 10 to 20% of children with JIA can develop uveitis. As mentioned before, symptoms of uveitis include eye pain, eye redness, and blurred vision. However, children with JIA and uveitis may not develop symptoms or eye pain until the disease is very advanced, such as at the point of irreversible vision loss. Therefore, patients with JIA require frequent vision exams to screen for inflammation, such as being seen every 3 months for many years. And if they have evidence of inflammation, they may be seen even more frequently, since they require monitoring during treatment. To evaluate for inflammation inside the eye, we examine patients using slit lamps, which is a microscope used in our clinics. During these slit lamp exams, we look for the presence of inflammatory white blood cells in the front of the eye, which indicates that uveitis may be present. However, it may be difficult for children to cooperate with a prolonged slit lamp exam, since evaluation of inflammation requires very bright lights on the slit lamp. Therefore, complementary or other alternative methods may need to be used. In my lab, I use non-invasive, non-contact instruments called anterior segment optical coherence tomography, or OCT. Anterior segment OCT allows us to rapidly and reproducibly acquire high-resolution images of the front of the eye. These images demonstrate anatomy similar to if we had performed a slit lamp examination. By processing and analyzing these anterior segment OCT images, we can look for the same inflammatory white blood cells, which are seen as white dots on a black background on the OCT image. By counting these white blood cells, we can determine the grade of inflammation in these patients. In our studies, we found that the anterior segment OCT can accurately identify cells in children with JIA and uveitis, and more importantly, the degree of inflammation seen on the images were comparable to those seen on traditional slit lamp examination. There are multiple benefits in using anterior segment OCT to detect inflammation. First is an objective, reproducible method that reduces observer bias. Second, it is rapid and uses light that is much less bright than the traditional slit lamp exam. This means it may be much easier to examine young children. My long-term goal is to develop automated imaging algorithms using artificial intelligence to detect these inflammatory cells in patients with uveitis using anterior segment OCT, and to test this technology in clinical trials. Thank you for your time and support of my research.